Hey everybody, and welcome to the last video of the chapter. We're going to be talking a little bit about how 3D movies work, but also talk a little bit about developmental problems that come out of depth perception. So last video I talked a little bit about 3D movies. So if you don't feel 100% about what we just talked about in the last video, go back and rewatch it, because what we're about to talk about for this slide, it gets really complicated if you don't have those basics down. The way that 3D movies work is basically by taking advantage of binocular disparity. So you may remember when we were talking at the very beginning of the chapter, we were talking about those two pictures and how they're very similar to one another. But if one eye sees just one of those images and the other eye sees just the other image, that our brain puts it together as having some semblance of depth. That's exactly how 3D movies work. So think about what we just talked about and about how we have binocular disparity. In other words, we have two retinal images, and that depending on how close those retinal images are to one another, we assume that those things are closer to us. Things that are very different between the two retinal images, we assume are farther away from us. So you may remember that crayon example. That's a good example to think about. So the way that 3D movies work is by taking advantage of this. So if you think about the old school anaglyphic, sometimes called anamorphic 3D, like the example at the beginning of the chapter was the Friday the 13th coming out at you. If you think about how that works, you have a red glass and you have a blue glass, right? And then you have the image on the screen, which is red and blue, two images that aren't quite on top of one another, right? They're slightly different, overlaid on one another. And so the way that works is that the red lens is going to filter out all of the red so that you're just left with the blue image. So you have one eye that's seeing just one image. Your other lens, the blue lens, is going to filter out all the blues so that you're left with just the red image. So you have, again, two separate images for your eyes. Now, they're not going to be perfectly identical. They're going to be slightly different. And that slight difference is going to be enough for us to get an appreciation for depth that is on the screen, or at least the illusion of depth that is on the screen. So the second, more recent kind of development in 3D is called polarized, and polarized is much more complicated. Polarized 3D basically relies on how the light from the projector hits the screen and bounces back at you. So basically, you have these glasses. And so if you've gone to the theaters anytime recently, you know that like the glasses that you wear, they're not colored, right? They're just kind of blurry, but for the most part they're clear. But they're actually kind of polarized in different directions. So you have some glasses that are polarized to block out light that is presented at one angle. You have a different set that is polarized at a different angle. And so what happens is that whenever you are looking at the screen, if you take your glasses off in the theater, you see that it looks kind of blurry, right? You have two images that are kind of almost on top of one another. When you put the glasses on, basically you're going to be filtering out, each eye is going to filter out a different image depending on how that light is polarized and hitting that screen. The video that I have right here really kind of goes into a little bit more detail and kind of a funny example there. I think is one of the better explanations of it. So feel free to check that out to try to work with that. This next little bit, you don't have to worry about it too much because it talks a little bit more about 3D televisions. I'm not going to test you about how 3D TVs work because those things aren't really, they didn't really catch on. So here's an example of what I was talking about with the theater, where you have different polarizations of light. And so in this particular lens, this is vertical polarization, which means that the horizontal light is going to be blocked, but the vertical is going to slide through that lens. And so the other lens is going to have the exact opposite. It's going to have horizontally polarized lens, which means that horizontal light refracted is going to go through the lens. And so again, each individual eye is getting a separate retinal image, and that is going to tell us a little bit about what we are seeing on the screen and how far away it's supposed to be from us. All right, now let's get into some of the developmental problems that come from stereoscopic vision. So we already talked a little bit about correspondence, and correspondence is whenever you cross your eyes. And so whenever you cross your eyes, that can make things really blurry, right? And so correspondence can also be whenever you are looking at something from one specific field of view, things overlap one another, and we can't really tell what or how many things we are seeing until we move around. And so this figure in your textbook is a really good example of this. So if you're seeing 1, 2, 3 circles like this, there are a couple of different things of what you might be seeing. So it could be that you are seeing these 3 circles next to one another, but it could also be that you are actually seeing 4 different circles and then a hidden circle behind that. Why? Because if you think about where the retinal images are, so here we have 3 different circles and 3 different circles. That could also be by looking at these 4 at a specific angle. That's correspondence problem. Correspondence problem typically don't come up all that much in the real world. The only time that I can really think about it actually coming up is something that you might see would be maybe bowling, or bowling where you have the pins, that are in front of you. You might not see that there's one pin behind another from your specific point of view. That's the only time I can think of. Stereo blindness is going to be the inability to really perceive depth because you're not able to put together the 2 retinal images that you have. This often comes from strabismus. And so you may remember strabismus. We talked a little bit about it in chapter 2. This is whenever your 2 eyes don't quite align. And so you have one eye that looks straight forward, one eye that kind of wanders away. For me, when I get really tired, one of my eyes gets kind of lazy, and so things get kind of blurry for me. And so that's basically stereo blindness because I'm not really combining those 2 retinal images at that point. So strabismus is something that comes out of a misalignment in our eyes. And this is not something that people generally realize because, like everything in life, if you're born with it, you don't really realize that you're different until you start developing problems. And so because we can use monocular depth cues, because we can close one eye and basically tell whether or not things are in front of other things or behind other things, depth perception can kind of be okay without using binocular disparity. But when you're talking about things like driving, when you're talking about walking around on a street, you want to make sure that you have all your depth cues correct, right? Because that can be, the difference of injury or not getting injured. Strabismus, one way that it can be cured is through surgery. So you can use surgery if you want to. There are a couple of other ways to cure this. One is if you catch it early on. You probably remember in kindergarten or pre-K that you may have went to school with somebody who had an eye patch, right? For me, I remember Philip Hall. His name was Philip Hall, and he grew up to be one of the super cool kids in our high school, but in pre-K, he walked around with an eye patch all the time. And the reason for that is because he had strabismus. And so what happens is that they put an eye patch over the strong eye, over the eye that is correctly aligned, so that the other eye that is incorrectly aligned has to basically work up its muscle and kind of get used to things. And then after 9 months or so, you can take off the eye patch and boom, you're cured. You're treated of your strabismus. That's one way to do it. After you become an adult, then it's a little bit trickier. There are other kinds of visual therapies that you can use. Some of the videos that I posted at the very beginning of this PowerPoint presentation look into that a little bit. So it can be cured, and so this is something that seems to be you want to take care of it as soon as possible, because if you don't, then it can be really tricky to cure it whenever you are an adult. Binocular rivalry is whenever you are looking at 2 different things and your eyes are kind of competing with one another as to what you're seeing. So, for example, if you were to move your face up close to the screen so you're seeing just the blue and just the red like this, basically what you see is going to be a combination of these things. Not a perfect combination. Sometimes it'll be a split. Sometimes it'll be most of what you see in your right eye. Sometimes most of what you see in your left eye. It goes back and forth. That's binocular rivalry. The key, though, is that we don't see both perfectly at the same time. And so if you were to look at this image right here with the red and the blue, you can either see the blue or you can see the red image. You can see this person, but you can't see them simultaneously. Does that make sense? You can kind of see them simultaneously, but it's really hard to really tell what the hell you're looking at. But if you're just looking at the red tint where you have this woman's face right here, then you can see that, or you can see the blue right here, but you can't see them both simultaneously. And so this is competition from our two eyes to really perceive what it is that we are looking at. And the same happens here if you are looking straight ahead right here in the center, and you move your head up so that your left eye is getting this and your right eye is getting this. Again, just like what we saw here, your brain is basically going to compete over what it is you're actually seeing. Is it mostly what you're seeing in your right eye, mostly seeing what or mostly what you're seeing with your left eye? So when we are working up towards developing depth perception, the way that we measure that is in what's called stereoacuity. And stereoacuity is essentially just a measurement for depth perception. So it's basically what is the smallest bit of difference in our retinal images can we detect to give us a sense of depth. And so don't worry too much about what dichoptic means. It's not necessarily important for this. What I want to show you is kind of at early ages, we don't have depth perception. So stereoacuity, what we're looking at right here is these lower values basically are bad depth perception. The higher values are really good depth perception. And so what this shows is that when we are about 2 to 4 months, really, really early in our development, we have really crappy depth perception, right? This is why, sometimes you'll see babies, they're kind of like looking around all over the place, and they can't tell if something across the room is right next to them, because their depth perception is not so good. But after about 5 months of age, that's whenever depth perception gets much better. The eye continually develops, just like we talked about in Chapter 3 when we were talking about low spatial frequencies. But our brain starts figuring out how to put together these two separate retinal images to give us something that looks like depth. And so, when that happens, basically by the time that we're 7 months of age, we're almost at perfect adult-like levels of depth perception. So this is something that happens very early in our developmental history. Let's see. So basically, that's all that I want you to take away from this particular figure. In this case right here, what we're looking at is how people are being tested with different kinds of stimuli. And so what you're looking at here is the percentage of infants that are making errors in depth perception. And so you have a lot of this going on in 3, 4, and 5 months. By the time they're 6 months of age, most of those errors have cleared up. All right, so I talked a little bit about strabismus and how strabismus can lead to stereo blindness, and this is an example of that. How if you are supposed to be looking at this particular image right here, this kind of wooden block, I guess you can't see it because of my big dumb head, but in the book, in the slides, you'll see this block right here. If your eyes are supposed to be looking at it, but one of them is slightly misaligned, you might be looking at something else. And because of that, because as what I just showed you about how this is something that takes place really early in our lives, development of depth perception, if this goes on for long enough, we can have some problems with that, and it needs to be corrected. So there are visual therapies to work with that. Let's see, I think that's pretty much what I want to focus on for the development side of things. This last figure just shows for kids that have normal vision, where their eyes converge at the exact same point, you can see that, again, right after, age 5, 6, 7 months their depth perception, their ability to combine these retinal images gets to be near 100%. For kids that have strabismus or kids that have any kind of vision that is not completely aligned, we see that in this same critical period of 4, 5, and 6 months, it drops precipitously, and then they can't perceive depth. So having these lines correctly aligned, having these eyes correctly aligned, is very, very important for that. All right, so moving into Bayesian perception, you may remember we talked a little bit about Bayesian perception in Chapter 4. The textbook talks about it a pretty good bit. Basically, Bayesian perception is the idea that our perceptual system is going to fill in the blanks a lot whenever we are looking for things, when we are trying to perceive the world. So you can think about your optic disc. You can think about the blind spot that you have in your eye. That is something that we don't see anything in, right? Instead, what happens is that our eye kind of figures out what's the most likely thing that we are going to see, and it populates it with that. So our nervous system is very probabilistic in that way. Our nervous system, our brain, is constantly trying to figure out what is the most likely thing that we are looking at. And so the same is true when we are talking about how we perceive space. That we are going to perceive things as being what is the given what we know about how the world works, what is the most likely kind of depth Q given what we know about the features of a specific object. So let me just give you an example. So I'll come back to this slide in a second. But let's say if I were to show you this particular set where we have these 2 pennies. Now there's 2 different ways that we could perceive this, right? There's 2 different ways we could perceive this. Just like we talked about when we were talking about occlusion back in a previous video, that monocular depth Q. That we can perceive this as 2 whole pennies. This one is in front of that one, right? Awesome. But there's another way to perceive that, which is that we perceive one of these as whole and the other as not whole, but they are the same distance apart. It's just that one is notched into the other. What do you think is more likely? I'm going to say that probably panel A, right, where we have one penny that is a little bit closer than the other one. The 2 other options that we have is that this one right here is gigantic and really far away, or that we have this one is not a whole penny, that it's just slightly smaller and is missing this entire spot right here so that they fit into one another. What's the most likely outcome? The most likely outcome is just that this one is on top of this one right here. So that seems kind of obvious, right? It is obvious because that is how our brain works. That is what our brain has taught us for the last 20 years of our lives or so, however old you are. Basically, how this fits into Bayesian perception is that our nervous system is constantly looking for what is the most likely outcome. And so if we're thinking about this, what's more likely? We already established that, right? That it's just that one penny is on top of the other. And so we're thinking about which of these is most likely to occur, and that is what we are assuming as what we are perceiving, we are seeing in front of us. All right, so finally we're going to end off with a few other depth illusions. And so here, these are just kind of fun little examples of how our perception can be fooled based on what we see. So we talked a little bit about this, and we talked about linear perspective and the vanishing point. You may remember this. And so these 2 individual men, they seem to be different sizes, right? Yeah, this one on top seems to be much bigger than the one down here. But they are perfectly identical in height. They are the exact same size, and I know it doesn't look like it. So if you want to, pause this and go up to your computer and do it, and you will see that yes, they are the exact same size. So why do they not appear to be the same size? Based on the depth cues that we have, we assume that this over here is farther away. And if it is farther away, then if they are identical size on our retina, one must be much bigger than the other for that to happen. So the texture gradient, if you want to think about it that way, says, just like the rabbit example that we looked at, this guy must be bigger because he's taking up the same amount of space in our retina as this one, which we know is closer to us. And the same goes for these images right here. So here, in these lines, E, for example, E looks like it is a little bit longer than C or A, right? But if we remove the environmental context here, we see that's not the case. That E, D, and C, that they're all the same sizes, right? And that A and B, A looks smaller than B, right? But they're actually the same size. So why do they look different? Based on these cues that we have around us, E looks like it should be farther away. And if it is farther away, then if it's taking up that much of our retina, the same amount as C is, then it must be pretty big for that to happen, because we know that it's farther away. So those are some examples. Another example is the Herring illusion and the Zollner illusion. And the way that these things work is kind of involving depth perception, especially the Herring illusion, which looks like these lines back here are farther away from us, thinking about linear perspective. And so this line appears to be curved. The lines in the middle, these two, they do not appear to be parallel. They appear to be kind of bowed, right? And again, you can take out a piece of paper and measure it, and you can see they are perfectly parallel and straight. But we don't perceive it that way because of the surrounding context. Same thing with these. These lines are parallel. The straight up and down ones, they're parallel, but they don't appear to be parallel because of these diagonal slashes. These diagonal slashes give us the impression that they are actually kind of crooked and tilted at one way. Same thing with these lines right here. These black diagonal lines are diagonal. They're diagonal and they're parallel, but they don't appear to be parallel. They actually kind of look like they're, getting closer to one another. Same thing here with these tire tracks. Basically, these black lines and the white lines are perfectly parallel, but our eye doesn't perceive them as being parallel because of how the surrounding context distorts what we see. And finally, another example of the Herring illusion. The red line appears to be curved, but in fact, they're not. Alright, so that's all that I have time for. I apologize for this video gone on a little bit too long. If you have any questions, let me know. Otherwise, we will be jumping into Chapter 8, which is so we're skipping Chapter 7, which is about attention, and I love that chapter, but we cover it in cognitive psychology, and I didn't want to cram in more material than we needed to this semester. So Chapter 8 is all about motion perception. And so we're going to go back to the movies and figure out how it is that we perceive movement. I'll see you there. Bye.